The classic example would be, we'll just use, here you can pick almost anywhere in the system and find issues to discuss. But one of the things that COVID did was result in huge staff losses across the entire country.
Yeah.
I would say that probably the medium-sized and smaller communities have felt this the worst because they already had a smaller population base to begin with, right? Yeah. So when a bunch of your nurses quit there, it's not like there's 1,000 more that are walking through the door because you're in a 20 million person city, right?
Yeah.
You're a city of a few 100,000 people. But when the pandemic broke out, for one, there was a general lack of preparation. But for two, you had these widely disparate responses based on how wealthy the hospital system was, how wealthy the community was, what kind of protective equipment they could even supply. There were hospitals that had barely any, or were having the nurses buy their own, right, to come in and work with a life-threatening illness. Right?
Gosh,
nurses were being asked to work, 12-hour shifts, right? So and then of course some of the nurses are getting sick, right?
Yeah.
And all these things are happening. Patients are dying at a much, much higher rate than we're usually used to seeing within almost any type of condition, right?
Yeah.
All of that stress is coming together on the legacy of, we already had all of these problems and grievances that had been boiling for years under the surface. So a lot of nurses just left, right? And then what you're left with is a hospital that has beds but no staff. And then you have patients who need the beds, but can't even get in.
Go to them because there's no one to staff them.
the bed. Yeah.